majestic raptors, symbols of freedom and the pinnacle of avian predation. Yet, their lives are fraught with peril. Habitat loss, collisions with vehicles and power lines, environmental toxins, and even illegal shooting lead to devastating injuries. When these apex predators fall from the sky, their survival often hinges on immediate, expert human intervention. This is where dedicated wildlife rehabilitation centers step in, transforming tragic circumstances into stories of incredible resilience and hope. Their mission is clear: to mend broken wings, restore shattered spirits, and return these magnificent birds to their rightful place in the wild. The journey back to the wild begins with a frantic call and a swift response. Upon arrival at a rehabilitation center, an injured raptor undergoes an immediate, thorough intake assessment. Trained staff carefully examine the bird, noting every detail from its species and age to the nature of its injuries and overall physical condition. This initial evaluation is crucial, as it dictates the urgency and type of medical intervention required. It's a delicate balance of speed and precision, ensuring the bird's safety while gathering vital diagnostic information. With the initial intake complete, the raptor moves into the veterinary clinic. Here, experienced wildlife veterinarians employ a range of diagnostic tools to pinpoint the exact nature and extent of the injuries. X-rays reveal intricate bone fractures, while blood tests and ultrasounds uncover internal trauma, infections, or poisoning. Many raptors suffer from compound fractures, soft tissue damage, or internal organ injuries due to impacts. The precision of this diagnostic phase is paramount, forming the bedrock upon which the entire treatment plan will be built. Often, a raptor's road to recovery necessitates complex surgical intervention. Fractures, particularly those involving wings or legs, require meticulous repair to restore function. Surgeons skillfully use pins, plates, and external fixators to stabilize shattered bones, allowing them to heal correctly. These procedures are incredibly challenging, given the delicate anatomy of a bird and the need for absolute precision to ensure future flight capabilities. Postoperatively, vigilant wound care and rigorous pain management are crucial to prevent complications and support the bird's comfort during the initial healing phase. Following surgery, the raptor enters a critical phase of acute care. This involves administering prescribed medications, antibiotics to ward off infection, anti-inflammatories to reduce swelling, and most importantly, pain medication to ensure humane and effective recovery. Keepers meticulously monitor the bird's appetite, hydration, and overall demeanor, adjusting care as needed. This early recovery period is often spent in a quiet, temperature-controlled enclosure, minimizing stress and allowing the bird's body to dedicate its energy to healing. Patience and careful observation are paramount during these fragile days. Once the acute medical phase is complete and bones have begun to knit, the focus shifts to restoring mobility and strength. Just like humans, raptors require intensive physical therapy to regain full function after injury. Without it, muscles can atrophy, joints can stiffen, and nerve pathways can lose their efficacy. This stage is about carefully reintroducing movement, preventing long-term stiffness, and building the foundation for the rigorous flight conditioning that lies ahead. It's a testament to the comprehensive approach that defines modern raptor rehabilitation, ensuring every effort is made for complete recovery. Rehabilitation specialists employ a variety of techniques tailored to the raptor's specific injury. Massage therapy helps to improve circulation and reduce muscle soreness, while gentle stretching carefully restores range of motion in stiff joints. In some cases, low-level laser therapy might be used to reduce inflammation and accelerate tissue healing. Specialized exercises are designed to encourage weight-bearing on injured legs and gradual wing extension. Each session is carefully monitored, pushing the bird just enough without causing pain or re-injury, slowly rebuilding confidence and capability. Beyond specific injury sites, overall physical conditioning is vital. Raptors need powerful core strength and impeccable balance to hunt effectively and navigate complex aerial maneuvers. Physical therapy includes exercises that promote perching, climbing, and controlled short hops, gradually reintroducing the muscle groups essential for flight. Environmental enrichment in specialized enclosures also encourages natural movements, allowing the bird to practice using its recovering body in a more natural setting. Every step, every flap, is a deliberate effort to prepare the bird for the ultimate test: sustained, powerful flight. As the raptor gains strength and mobility, it graduates to larger, outdoor flight enclosures, often called mews or flight cages. These vast, open spaces are meticulously designed to simulate natural environments, providing ample room for extended flight. The increased space allows the birds to begin flexing their recovered wings, practice short flights, and build endurance. It's a critical bridge between the controlled environment of the medical clinic and the boundless freedom of the sky, giving staff the first real glimpse into the bird's aerial potential and assessing its readiness for the next stage. One of the most vital components of flight conditioning is creance flying. This involves attaching a long, lightweight line, a creance, to the raptor's leg jesses, allowing it to fly significant distances while remaining safely tethered to a handler. This controlled method enables specialists to assess flight patterns, endurance, and agility without the risk of the bird escaping or crashing if its flight isn't yet perfect. It's a delicate dance of trust in training, gradually pushing the bird to rediscover its full aerodynamic capabilities under watchful eyes. Beyond initial flight, the goal is to build stamina and agility, crucial for a raptor's survival in the wild. Sessions become longer, and handlers encourage more complex maneuvers like tight turns, dives, and ascents. Observing these flights allows experts to identify any remaining weaknesses or compensatory movements that might hinder survival. The birds are pushed to their limits in a controlled environment, ensuring that when they are finally released, they possess the strength and skill to outmaneuver prey and navigate turbulent winds with effortless grace, just as nature intended. A raptor's ability to hunt is non-negotiable for survival in the wild. Therefore, a critical stage in rehabilitation is live prey testing. Under careful supervision, the bird is presented with live prey, such as mice or small birds, in a controlled environment. This assessment determines if the raptor can successfully locate, pursue, and capture food. It's not about cruelty, but about ensuring the bird possesses the innate predatory skills essential for independent survival. A raptor unable to hunt efficiently cannot be released, highlighting the ultimate goal of self-sufficiency. Beyond physical prowess, a raptor's mental state and natural behaviors are rigorously evaluated. It's crucial that the bird maintains its innate fear of humans, a vital survival instinct in the wild. Staff minimize direct human contact, especially during later stages of rehabilitation, to prevent habituation. Assessments observe natural foraging, perching, and social interactions, if applicable for the species. Any undue comfort with humans or lack of wild instincts can be a disqualifying factor for release, emphasizing the priority of their wild identity above all else. Before a raptor can earn its freedom, it undergoes a comprehensive final health check. Veterinarians confirm that all injuries are fully healed, feathers are in pristine condition for optimal flight, and the bird is at a healthy weight. Beyond medical parameters, strict release criteria include demonstrated sustained flight ability, proven hunting skills, and a strong, natural aversion to humans. Every aspect of the bird's physical and behavioral readiness is scrutinized to ensure it has the absolute best chance of thriving independently in the wild, maximizing its prospects for a successful return. After weeks, months, or even a year of intensive care, the day finally arrives, release day. It's a moment of profound joy and quiet triumph for everyone involved. The bird is transported to a suitable habitat, ideally near its original rescue site, to maximize its chances of re-establishing territory. With a gentle lift, it's set free, soaring into the sky, a testament to the unwavering dedication of its human caregivers and the indomitable spirit of the wild. This is the ultimate reward, witnessing a life restored, a broken wing mended, a raptor return to its natural destiny. The journey doesn't always end at release. For some birds, especially those recovering from complex injuries or rare species, post-release monitoring is employed. Tiny leg bands or even miniature transmitters provide valuable data on survival rates, dispersal patterns, and long-term success. This ongoing research helps rehabilitation centers refine their techniques and contributes to broader conservation efforts. It underscores that every rescued raptor is not just an individual life saved, but a vital piece of the ecological puzzle, strengthening the health of entire ecosystems and contributing to our understanding of these magnificent creatures. Despite the heroic efforts, not every raptor can be saved or returned to the wild. Success rates vary widely depending on the type and severity of injury, the species, and the resources available to the rehabilitation center. For example, a simple soft tissue injury might have a high success rate, while complex neurological damage or severe poisoning might be insurmountable. These centers also face constant challenges, from securing funding to managing volunteer burnout. Yet, the dedicated professionals and volunteers persist, driven by an unwavering commitment to wildlife and the belief in their vital mission. Behind every successful release is a team of unsung heroes, veterinarians, technicians, rehabilitators, and countless volunteers. Their work demands tireless dedication, profound scientific knowledge, immense patience, and an unwavering belief in the value of every single life. It's often a physically demanding and emotionally taxing endeavor, involving long hours and difficult decisions. Their compassion, combined with cutting-edge medical science, is the true engine driving these incredible transformations, turning tragedy into inspiring stories of hope and ecological stewardship that resonate deeply within the conservation community. The work of raptor rehabilitation centers is a critical component of wildlife conservation, but they cannot do it alone. Supporting these organizations through donations, volunteering, or simply spreading awareness can make a profound difference. Every action, from reducing pesticide use to advocating for habitat preservation, contributes to a healthier environment for these magnificent birds. By understanding the challenges they face and the dedication required to save them, we can all become advocates for their future, ensuring that the skies remain filled with the powerful presence of raptors for generations to come.